For many people, the principles of the Canadian healthcare system define Canada's values of equity and solidarity. It provides a universal health coverage program on a basis of need rather than the ability to pay. But the Canadian healthcare system has many problems. Family doctors are in demand, wait times for surgical procedures are increasing, and people are experiencing lengthy wait times in their emergency rooms. Canadians have been affected by these conditions in some way, whether they know someone or by experiencing it firsthand.
It started out with a herniated disc, and then a nerve got compressed in my back, unable to move my leg. I had blurred vision. I fainted at school, which resulted in me being in the hospital. At the hospital, the waiting time was super long. Yes, there are other patients, but when you're triaged, you're supposed to be seen in order of that. And when you're having blurred vision, I think that is a pretty, serious symptom.
The Canadian healthcare system is mainly funded by the government, spending about $160 billion or 10.6% of GDP in 2007. But there is another factor that affects the healthcare system immensely: the economy. Canada experienced an economic recession in the mid-1990s, causing revenues to collapse and leading to massive government deficits. Public health spending per capita fell, which led to cuts in federal government transfers to the provinces. Hospital budgets tightened, and the number of physicians being trained were reduced. According to the Canadian Medical Association, the shortage of healthcare professionals is the most important issue facing the system today. Polls have shown that 49% of Canadians believe that current hospital wait times for surgical procedures are unacceptable. Statistics Canada reported in June 2008 that about 4.1 million Canadians aged 12 and older don't have a family doctor. 1.5 million people simply could not find one. On average, medical students graduate with about $100,000 in debt. Increased funding and scholarships for students in medical schools would encourage more Canadians to become doctors. Another solution is to put greater emphasis on prevention. 2/3 of total deaths in Canada are due to chronic diseases such as cancer and cardiovascular diseases. Taking care of our own bodies by living a healthy lifestyle would reduce the chances of developing them, and in turn would bring significant economic benefits. The Canadian healthcare system has its positives and negatives. The government has made extra efforts to develop a better system, one that will deliver a quality healthcare system in a timely manner.